So just getting started, I just want to give you a little bit, we have time for questions and at the end, so don't worry about that. But I am just going to give you a little bit of information about who we are, what SPOR is, and what MSSU is, and all of those things. So it is a national initiative through the Canadian Institute of Health Research, and focuses on what health researchers know and moving it into what health providers do. And so I just changed my screen size here a little bit, sorry folks. We are one of 11 units across the country, and it's really about providing evidence needed to inform the development of health policies and improve the healthcare system. It is about moving scientific discoveries to the bedside and producing the information that decision makers and healthcare providers need to improve care. And so there's some information. If you're not familiar with SPOR, you should probably go and check out the website, the CIHR website, and learn a little bit more about who they are and who we are. Our guiding principles: that patients need to be involved in all aspects of research to ensure questions and results are relevant. Decision makers and clinicians need to be involved throughout the entire research process to ensure integration into policy and practice. An effective patient-oriented research requires a multidisciplinary approach, and overall, SPOR embodies a mandate for advancing equity, diversity, and inclusion in health research. We are outcome-driven. And so those are some things just that are our guiding principles with how we work at MSSU as well. So there, as I mentioned, it's a national strategy. There are 11 units across Canada. The MSSU is over 3 maritime provinces. So we have offices in 5 locations, 3 in New Brunswick, and 1 in Prince Edward Island, and 1 in Halifax. So that just gives you a little bit of who we are and all of that. Now we're really here to talk about this trainee support. It used to be called Student Award or Studentship Award or whatever. We had to change it due to regulations with CIHR, so now it's trainee support. And the good thing is that does cover all ranges that we are supporting financially. Prior to last year, the New Brunswick and Nova Scotia held 2 separate competitions. There was the MSSU Student Awards, and then the NBHRF, which is the New Brunswick Health Research Foundation, and MSSU Studentship Fellowship. The MSSU Awards ran between 2015 and 2021. And New Brunswick was a little earlier, 2014 to 21, and you can see, the number of students or trainees that we have supported over the years. Prior to last year, the MSSU was just funding masters and doctorals, and we did add the or the fellowship program last year because New Brunswick was doing that. So we wanted to make sure that we were all on the same page. So really we combined them last year so that there would be a consistency across the Maritimes in eligibility requirements, application review process, and funding levels for trainees in all 3 maritime provinces. And last year, the MSSU in all 3 provinces we supported 19 trainees, but that's wrong. There are 9 trainees. I wish we could do 19, but there were 9 last year that were supported for provinces. So a little bit about our objectives and what it is that we're trying to do. We're really, the overarching goal is to support research trainees to develop the capacity for undertaking research that both meaningfully engages patients and addresses priorities. So we're looking at pursue health research training in any discipline, not just those traditionally related to health service sciences. Any human themes are eligible, regardless of proposed methodology or models. We really want to have a broad breadth, and just this week, for the first time, the Dalhousie Faculty of Dentistry reached out with a concept that they're looking into and wanted to know whether that would be applicable. And I said it sure would. So for the first time, they're looking at putting through an application for one of their trainees, which is really exciting. As in the past, we've made a few changes, but I'm going to talk a little bit about what we have that we need to have, and it's been a requirement in Nova Scotia and Prince Edward Island pretty much since the beginning, and in New Brunswick is now as well, and that is when you have to have a supervisor on your team who is an MSSU scientist. If you are not sure if your supervisor is an MSSU scientist, you can ask them. You can also go to mssu.ca, and there we have a list. I can't remember what it's under, but there's one like research, like MSSU scientists, and there's a whole list of all the scientists. There's over 150 in the 3 provinces. So, and if your supervisor is not an MSSU scientist, they can become an MSSU scientist, and there are benefits to them to do that besides being your supervisor. One of them being a reduction in fees with Health Canada Nova Scotia. And there's an application on the website, and it is really a simple thing to fill out. And the main requirement is that they have to be in an academic position in a school in the Maritimes. A few things that were new last year, and we're kind of excited about that. One of them is that there has to be a patient. We now actually call them patient-public partners, so I apologize for that. I'll clarify a little bit more what that means in a few minutes. But they have to be engaged throughout the project as a team member, if possible. We recognize that that's not always possible, and it depends on where you are in your research and you know, a number of other factors. But as much as possible, engaged as a team member, and have what's called a healthcare knowledge user. And I've put a link there, but a healthcare knowledge user, according to CIHR, is defined as an individual who is likely to be able to use research results to make informed decisions about health policies, programs, and/or practices. A knowledge user's level of engagement in the research process may vary in intensity and complexity, depending on the nature of the research and the information needs. A knowledge user can be, but is not limited to, a practitioner, a policymaker, an educator, a decision maker, a healthcare administrator, a community leader, or an individual in a health group, charity, patient group, private sector organization, or media outlet. So it's really around having some advice into how this, the research that you're conducting can be help to move forward policy, which is always something that we're trying to look at. Projects have to be relevant to the mandate of MSSU. You can find that on our website, and I can put that. I meant to have some of my chat stuff ready, but I don't, and now it's not going to let me do it. But if you go into mssu.ca, the website's really simple, mssu.ca, about us and the strategic plan, and it talks about our core competencies and what we're looking for. I think that one of the most important things that that our selection committee is looking for is how your research addresses an issue in the province that you attend school in. So how is it a healthcare issue in the province? We had some discussion this year about whether it should be a healthcare priority in each of the provinces, and we determined that not all of them were necessarily very good patient-oriented research projects. So we went back to addressing a healthcare issue in your province. Now, I want to adjunct that by saying, and it does not mean that it has to be just in your province. It can be a national thing. We have had a discussion with a supervisor this week. It's a national project. It's going to have national impact. I said, just link to how that it will impact your province. So that was great. I said, it doesn't have to be limited to your province, but how does it impact them? And make sure you understand that how you are going to measure the outcomes that matter to patients and how that has been determined. Some new things that we added to last year's competition, and it certainly made some very interesting, project proposals to engage your healthcare and knowledge user, to include a patient engagement plan. So in that, describe how patients will be engaged in the project, remembering that patients are partners and they are not subjects for data collection. And I'll talk a little bit more about what that could look like, but in a knowledge translation plan and description of sex and gender considerations in the research proposal. So those are all things that you need to include, and there's lots of links on MSSU website. There's some information that you can find. That's where all the documents are. I'm sure that some of you have surely already looked at them and have an understanding of what it is that we're looking at. But there is a downloadable program overview, which I thought was a great idea this year, because then you can look at it and you don't have to keep going back to the website. You have your clarity. There's a research proposal application. There's self-identification forms. So those are all on the website, and the information to fill in your application. In order to be eligible, you have to be applied to, be accepted in, or enrolled in a full-time thesis-based master's or doctoral program, or applied, been accepted, or registered as a postdoctoral fellow. You need to be under the supervision of an MSSU scientist in a university, college, or institution in New Brunswick, Nova Scotia, or Prince Edward Island, and obviously be engaged in research activities related to patient-oriented research. It was a big change we made last year, was putting more emphasis on patient-oriented research, and we found the projects were very reflective of that, and the comments from those who have had to submit their final reports have commented on how including the patient public partner in their project improved their research, and we're very aware of that. So that was really exciting feedback to get. Funding is non-refundable or non-renewable and issued to recipients as master's level, $10,000 for 1 year, PhD, $15,000 a year for 2 years. Postdoc is $20,000 a year for 2 years. So you cannot reapply for the same project, although we have had people who have applied at their master's level and then their PhD level. I don't think I have anybody yet who's applied at those levels and also at their postdoc, but as long as it's a different project, you can reapply. In Nova Scotia, Research Nova Scotia is the administrator of the funds, and so they I give them the information and they take off with it. And in New Brunswick, it's the New Brunswick Health Research Foundation that manages all that stuff for us. So what is patient-oriented research? So it is a continuum of research that engages patients and providers as partners, addresses patient-identified health priorities, and aims to improve patient outcomes, and aims to apply knowledge generated to improve healthcare systems and practices. So really, that's from SPOR strategy, and talks about patients involved in all aspects of research to ensure questions and results are relevant, decision makers and clinicians involved, to ensure integration into policy and practice. Those are some of the things that you can keep in mind as you're thinking about, do I have a patient-oriented research project, or how can I communicate that to the selection committee that is my project. So you need to really clearly articulate how the research that you undertake is patient-oriented in nature, and how you are going to integrate patient-oriented research throughout your project. And as I mentioned before, the impact and relevance to the patient population in the Maritime province in which you live and attend university. And there is, I'm sure if you know from, well, if you've looked at the application, you know that there's a section on that. How is this POR and how are you going to do that? So meaningfully engage patients as in your project. So what does that look like? So active involvement of patient public partners in the project that is beneficial for all parties across the research project. You need to describe how patients will be actively involved in planning, decision-making, co-leading the creation and/or sharing of the knowledge within this research project. Patient-identified priorities, and that was one of the biggest comments that I recall from the reports from last year who have completed, was that their research question actually changed as a result of having a patient partner on their team. And it was a much richer question. So again, I get all goosebumpy around that because I just think that's such lovely stuff. Summarize how patients with lived experiences have helped or will help identify the research topic, how it's a priority. You want to talk about the methods used to identify or validate the research priority among patients. How have you determined that this is a priority? Outcomes that are important to patients. What outcomes have been chosen, how they're important to patients, and how will they be measured? Explain how the knowledge created through the proposed research will be used to improve outcomes that are important to patients. And a multidisciplinary team. So just, how will the research be influenced by relevant disciplines and stakeholders through the project? So these are some examples of, ways that you can engage your patient partners or your patients as partners. So identifying research topics, helping plan and organize a study, helping recruit participants, helping to carry out the study, governance models, helping to share the results with others. So those are the things that you can start thinking about how we engage. Remember, so a trainee lived experience alone. So if you're doing a project on, I'm going to pick my bugaboo is osteoarthritis. So if you were doing a project on osteoarthritis in population of not a senior age, because I'm not senior yet, but and then if I was the person with osteoarthritis, I would not be considered to be the criteria of patient engagement. So your own lived experiences aren't enough. Well, they are enough, but they don't make that eligibility for this project. So meaningfully engaged as partners is an important thing, and they really want to be articulate how you're going to do that. There are some resources there, if you're not familiar with them, that you can get off the internet. One of them is the IAP2 spectrum of engagement, and that's the spectrum that includes from inform to empower. And I know a few of you have already been on our MSSU patient-oriented research training, and we've discussed that at length. As same as the Porlet that comes out of Saskatchewan. It's an amazing tool. They've just updated it, and it gives you direct ideas of how to engage at the different levels. And I want to be clear, and we talk about this in our training. There isn't a level that's necessarily better than another. So, sometimes we think, oh, I have to go to, consult, or I have to go to empower or collaborate to really make this a meaningful project. And that's not necessarily true. Some of it is going to depend on what your research is, what level you're applying at, whether master's, PhD, or postdoc fellow. There would be a little bit of a different expectation from a first-year master's student, doing POR for the first time, may not have those same resources as a postdoc fellow who's been very engaged in patient-oriented research over their career. So look at those things that don't get hung up on that. Our selection committee does use that tool as a guidance, but there's a scoring number on it, but that's really isn't what we're looking at. It's just a guidance. So we really encourage you to look at these two elements. One of them is an Indigenous. If you're doing Indigenous research, there's a tool out of one as well. They're great tools and very helpful. So if you're aiming to, improve the outcome of patient outcomes, there's really just some examples here that you can use. How is it patient-reported outcomes, like or what we call PREMs, their experience measures. How has their quality of life been improved? How did you measure that? What are some management of symptoms and pain measures? Clinical improvement measures? Has the length of stay or cost of effectiveness, has those things changed as a result of some of this? So these are just some ideas. There's so many, but I just wanted to throw a few out there. We also do ask for, as I mentioned, a patient engagement plan. There is a really great tool on the Newfoundland support unit, which is a patient and public engagement planning template. It's awesome. We don't even want to try and recreate it because it's really helpful. So you can go look that up. And there's also some resources on our website for KT plans. And so again, if you go into MSSU.ca and then get support and resources, and if you put in KT or knowledge translation, it'll filter to just those things. And I just checked this week to make sure that they were all still there, make sure, and they are definitely there. So that can be really helpful, so that you have an understanding of how things will do. So how we do this for evaluating and selecting applicants to receive the awards. I don't know why these notes are on this particular page, but here they are. So we have our selection committee is made up of MSSU scientist volunteers and 4 patient partners, one of whom is on the call now, and I'm not sure if the other one's joined in yet or not, but each application that has been deemed eligible to move forward, and I will, well, this is being recorded, I can't share. It's not very often. There was one, I have made one ineligible in the past because it didn't really cover what we were asking, but it's pretty rare. You'll have, each application goes to 2 MSSU scientists for scoring, and then the top ranked ones, so we do an average. If there's a lot of discrepancy, then I reach out to them and try and get an understanding of where they were coming from. Then the top ranked ones then go to patient partners, or patient public partners, pardon me, and they review the engagement plan. So they review the patient engagement plan and the knowledge translation plan. They will have access to your whole application, but we're really only asking them to do those 2 pieces for their expertise in that role, because we do have one who is not, is not researcher, and doesn't have a lot of research background. We just ask them to review those things, and we give them some information if there's relevant information around. We don't give them the transcripts or any of that. It's really not relevant for what we're asking them to do. We determine that if they're getting an application, then it's already passed some of those points through the MSSU scientists. Then the final decisions are basically made once we get all those things. There's a committee meeting, we have a discussion. They're again re-ranked, and then I inform NBHRF of the rankings and give them that information, and they make the decisions within New Brunswick for who's going to be awarded funds there, and in Nova Scotia and PEI, the decisions are basically made by the executive director and myself based on those. All decisions are at the discretion of MSSU, and there's no appeal process. There is an opportunity for feedback. So all of the reviewers, so the 2 MSSU scientists and the patient public partner, fill out a rubric with comments on where their scoring came. It's a universal scoring, so there isn't a weight on any one section. And then they give me that with their feedback, and after I can provide that information after the decisions are made. And you can just reach out to me and say, hey, I'd really like to get my feedback. And I have seen definitely one year a trainee did not receive funding and took the feedback, and then the next year did get funding. So there's some valuable information in there. So keep that in mind. And it's awesome that our reviewers do that, because, it's a lot of work to provide that, but it's really helpful. Justification of consideration of sex and gender. I'm not going to read all of that, but we have a sex and gender science team. One of them is an MSSU scientist, Dr. Natalie Rosen at Dalhousie, and then there's 2 of her mentees, and they worked a lot on, they updated some of this stuff, and this is a really cool tool, and it's not on the website yet, but I know that we're trying to get it up on the website. It hasn't been finally approved, but I snuck it in here so that you folks could see it, but a little bit of a template of how to move through the flow process of how to do things, and then all the resources. So this will be available on the website, but I'll just give you some information there. They did some really great work on those tools. So evaluating the evaluation criteria. So research expertise and potential. So we do look at your, academic record, but we're also looking at, leadership abilities, and that some of that comes from the reference letter from your supervisor, and that's one of the things that's we ask them to address. And, yes, if there's any other, what you have done, research contributions and things that demonstrate some of that leadership. Obviously, your project, your description, and your the research proposal itself, the integration of the patient engagement plan, the potential for relevance of research on the patient health population. And this is where we really want to get a little bit of an understanding of who you are as well. And that is, why you think you should get funding in a little nutshell. What are your goals, and how do you want to do this in the future? What is your desire to be in this? And so those are the things that we look at. And again, it's a universal, so it's not by weight, but rather on each piece, but rather overall. A couple of things that if you are funded, that you are required to do, and that is participate in patient-oriented research training facilitated by MSSU or offered by MSSU. I'll just leave it at that. You do not have to have funding in order to attend our patient-oriented research training. It is free. It is free to anyone and everyone. And there's a session unfortunately, there's not one in March, before the training, but you don't have to. If you want to get in, there's a session scheduled for April, May, and June, and you can find those on the website under the events page. I think April's the only one that's advertised right now, but you can reach out to Shelley Strickland, whose email address is there, and find out. I know that there's a couple of people on the call who have attended it, and we have somebody new who's going to be facilitating it as well, so that's great. We have some training that's been recommended by our sex and gender team, and you would be sent the links for that. Our Indigenous allyship and engagement. We have a recording of 2 events that they provided for us, And we're just trying to get finalized on an equity, diversity, inclusion, and accessibility tool that was offered to us, and we're just trying to get it up into a recording. But basically, anything that you would get all those details, and you don't have to be funded in order to get that information if you wanted it. And any other pertinent activities identified by us during the term of the award. So if we have a health summit, as we did last year, that's a broad one, we had the opportunity for students to do poster presentations and things of that nature. So, tips, pay attention to word count. I am the receiver of all applications, and if I find that you have gone over your allotted word count, because it comes to me in a Word doc, so it's pretty easy for me to figure that out, and if you've gone over your amount, then I can cut that off. If it's a few words, I'm not going to, but we've had some, and partly it's because of our reviewers. We're trying to be respectful of their time, and so make sure that your proposal fits into the required timeline. Use lay language, okay, not avoid scientific jargon, remembering that even though we have, our MSSU scientists or academics, they may be reviewing an application that is not within their area of expertise. We try and match everything up, but sometimes we just don't have that availability. So lay language, plus for our patient public partners, plus that is the kind of the guideline for anything having to do with patient-oriented research, is that we use lay language because we want it to be accessible for everyone. And if you need some assistance and aren't quite sure and you want to reach out to our patient engagement coordinator, her name is Lauren McLaughlin, and she's out of New Brunswick, but she's great. I know she's already talked to a couple of students, just kind of helping guide like how they could engage patients in their project. Everything has to be submitted through the MSSU website by March 24th, 2023, 2 p.m. and it gets shut down at 2 p.m. So you wouldn't be able to apply after. I'm a little bit lenient. Last year we had a supervisor and a student who were deathly ill. The supervisor got hold of me and said, I can barely hold my head up. I remembered I don't have this reference letter. Can I get it to you on Monday? And then she said, by the way, the student's name is blah, blah, blah. And then the student emailed me and then said, oh, I know I missed it, but I was sleeping. I've been up vomiting all night. And I said, just send it to me. Like, I'm not a meanie, but there are guidelines. We have to follow them. And I ask that you do your best to get them in on time. Your letters of reference come directly to me from the supervisor, and they also need to be into me by March 24th. Award decisions will be ready early June is my hope, if everything goes well. Nova Scotia tends to be a little bit quicker because New Brunswick has to go through a committee meeting of their own. So depending on when that is, then I'll try and make sure that everything's to them on time, but sometimes they're a little bit further behind. NBHRF had some challenges last year with getting their process is a little bit different than MSSU, and with Research Nova Scotia, they're trying to improve that so that it makes it a little bit easier. But if you're awarded funding in New Brunswick and NBHRS says, I need you to put this into our portal or do something, just do it. Like, just do it, because it'll make things go a lot faster. And then the funds are available on September 1st. So there, I've just I just kind of really went through a whole lot of stuff. And yes, Julia, in terms of the slides, they will be posted on the website on the events. So that's just the easiest way to do it. And so I know that the communications already has the slide deck or the PDF of it. And she was hoping to get it up tomorrow. So you would go to events and go to past events, because this will immediately go to past events, and then find this, and there'll be a listing of that and the recording. And I'm not sure when the recording will get done because I have to process it and get things done. But yes, you will get the slides. All right. I'm not sure how to pronounce your name, the person with your hand up. Is it correct? Tell me.
Okay. Can you hear me?
Yes.
It's Korede. Thank you
Correct.
so much.
Okay, lovely.
Thank you. I just have two questions. My first one is regarding the letter of reference. So I just want to ask, does it have to come from the supervisor or can it come from any of your professors?
That's a great question, and thank you for asking that. It does not have to come from your current supervisor. So it can be from a previous professor or someone who has knowledge of you. And that's a great question, because you want to make sure it is somebody who has knowledge of you, because sometimes your supervisor, it may be their first year with you, and so they may not know that. So great question. Thank you for that.
Thank you so much. And the second question is there any way we could save progress in the application form? Because I tried to start it, but I say that once I start, I just have to submit. There's no way to click whether saving my progress, then come back to finish it up. There's nothing on that.
I don't know whether we can do that. And the reason is that we've had a lot of issues with our website, and on the day before this went live, they had to change all the forms and plugins. So I'm not sure whether that's possible. So I would say make sure you have it in a Word doc first. Take all what you need to put in there, put it in a Word doc, and then copy and paste it. And hopefully that will allow you to do it. So finalize it in a Word doc first and then copy and paste. I will ask if that's possible, but I'm kind of unsure that it will be, based on some things that I know are going on in our back end.
Okay, all right. Thank you so much.
Okay,
and my last question is, the last one is it possible, like, for record purpose, I might want to keep a copy of my application at the end of it. Is it possible to do that? Like to save a copy of the application, the full application? I know it's not possible to save it as you go, but after filling everything in, is there a way we can have it saved, like have it saved on my computer, just for record?
I don't know, and that's why I would suggest that you make sure that you put it into a Word document exactly as you're putting it in. But if I get them, so if you do want it, if you know, like after you've submitted it, and just send me a quick email and say, Sharon, can you send me a copy of that?
Okay.
Yeah.
All right.
Yeah.
Thank you so
and you'll
much.
you'll get a confirmation that it has been submitted.
Okay.
But I don't think it includes everything, because yeah, I think it does. But you can always check in with me. I dedicate a lot of my time around the end of this March 23rd, 24th, 5th, 6th, 7th to be dedicated for questions and making sure things went the way you need them to. So,
okay, thank you so much, Sharon.
You're very welcome. Michael.
Hello.
Hi, you have a question?
Yes, thank you for the presentation. I was one of the applicants last year.
I know you were.
Okay. All right. So I was placed on the alternate list. I wasn't sure what that is. And my major question now is, if I am to apply again, how much of changes should I make in the original application? If I'm to submit most of what I wrote before, is it going to count as self-plagiarism or something? Yeah. And then the next question I will have is, I'm just learning that this is it funded part of a research Nova Scotia? Yes, because I got a funding from a research Nova Scotia. So does that make me ineligible to apply for this?
No, it does not. As long as you stay within your university cap, you're fine. You can have multiple awards. What it means when it says that you were placed on the alternate list, it means that if somebody who was on the funded list couldn't accept their award for whatever reason, for university cap is sometimes one, although I know Dallas has been upped, which is great, then you would be the next person offered. That's what it means when you're put on the alternate list. So, so you can probably infer from that, that means that you were very close. In terms of what you can do to change it, I would change it up a little bit if you can, by giving a little bit more, what have you been doing? So where are you now in your research? And I mean, I can't go through your program, your research and say, you know, but did you get the feedback, Michael?
Not really. I did not get any feedback besides the decision letter that I got.
Well, if you want, I can send you the reviewer's feedback if you didn't get it.
Please, I appreciate that.
Okay, I will do that.
Thank you.
You're welcome, because there might be something in there that will give you some indication of what you can do.
Okay.
Perfect. Emily.
Hi, Sharon. I know at the beginning of the presentation, you mentioned that 9 people were given the award last year. Just wondering if there's like a cap or how many awards you anticipate giving out, if that makes sense.
Yeah, so we were asked this question last year. It was actually the program person from MBHRF and I were on the call, and I got to look. I said, okay, what do we say? And the answer is we give as much as we can. There isn't a cap on the number. There is a budget of how much money we have. And obviously I'm not going to share that with you. And I don't know what New Brunswick's is right now. I haven't received that yet in terms of what they are able to provide, but it's not, it's a money amount. And previously, like the year before in Nova Scotia, we provided $10,000 one-year awards. So we just went like, that's, everybody's getting the same, it's 1 year, and we were able to award 10 students. Because New Brunswick did things a little bit differently, we compromised back and forth on how we were doing the awards, and we did have some trainees advising us in that committee when we rewrote the application last year. And they really pushed for whenever, like particularly for our PhDs and our postdoctoral fellows, to try and up the money and up the length of time. So that's where we came with a compromise. But no, I can't give you that much information, sorry.
Helpful, thanks so much.
Okay, thank you. Julia.
Hi, Sharon. I have a couple questions, actually. I wanted to ask, so I'm in New Brunswick, and I know previously for the MBHRF award, you couldn't hold multiple awards. So I just want to make sure it's saying that that's not the case anymore for this.
That is not the case because MSSU is making that decision.
Perfect. Well, that's great.
Yeah, they may ask you in the portal. I'm trying to get you not to have to go in through their portal. That's what we're trying to do, is that I can just send them the information and they can process it. But I know they're different because they have to have university sign off. But no, I've made that clear with them that that is not okay, and even changed. We've made, it's not an issue.
So for this application though as well, we still have to go through the NBHRF portal as well as the MSSU portal?
No, you send everything to MSSU, send everything to me. The only reason is if you were funded, then you may have to go through the portal if they haven't gotten that resolved.
Okay, no problem.
Okay, but for this, and we are using NBHRF, the CCV template, because they already have it and we didn't. So, but that's pretty simple. But you know, it's nothing. It's no big deal that it's there.
Okay. Another question I had is, does it matter how far into, for the doctoral award, does it matter how far into your doctoral program you're in before applying?
No, it doesn't. So what we ask is you are, you know, that you know that you have 2 years.
Yeah, okay.
Right. I mean, and so I tried to word that. The wording was kind of awkward last year. So I did change it a bit so that people know that basically what we're going to do, we're not going to fund somebody for 2 years if they're in their last year.
Mm-hmm.
Right. So that's really all it is. It doesn't matter where you are. And I know I did have a question from somebody from a postdoc fellow said, like, my contract finishes this year, but I know it's extended. But do I said, put your anticipated completion date.
Right. Okay.
Okay, so you anticipate it. Okay.
Another thing I wanted to ask is about the healthcare knowledge users. Is it possible for that to be, like in my case, after hearing you talk about it, I think my supervisor would fit into that role. Is that possible?
Yeah.
If they could?
Yeah. Yeah. And talk to your supervisor about that if there's somebody else, but I'm not going to get real picky on that.
Okay.
If that fits. Yeah. Yeah.
Well, yeah, I'll chat to her about it and we'll see. And then last question is about the outcome measures, like including some sort of positive outcome measure. What if, because my research is very, I guess it's sort of like a needs assessment and less about an intervention.
Okay.
So I'm not sure in a case like that, is it still applicable? Like, can it still fit into this if there's not necessarily an outcome?
So what would be the outcome of doing the needs assessment?
Well, basically gaining knowledge to then give back to the stakeholders, essentially.
Okay. So
Yeah.
so use that.
Okay.
Yeah. Like, why are you doing this? What are you hoping to get out of this needs assessment?
Okay, gotcha.
Okay.
Thank you so much. Appreciate
You're
it.
welcome. A few more minutes if anybody else has any questions. Did I cover it that well? Oh my goodness. Momina.
Hi, Sharon. Thanks so much for the presentation.
You're welcome.
Just two quick questions. The first one, you referred to the cap at Dow. How does that sort of work if we hold other funding, and when is a good time to apply if that's the case? Is it honorary if we have others that are at the cap?
Yeah, if you were, so I don't even know what Dell's cap is. I just know that it increased. And I know that nobody from Dell had to turn down money last year. So I'm hoping that it's a reasonable cap. If you are already at the cap, then you can still, you certainly can still go through the process and be, and then you would have an honorary award, which is still not a bad thing to have on your resume, right? So if that was the case, and you reach your cap, it would just become an honorary award.
Okay.
And we would promote that.
Right. Okay. Thank you. There's no way to defer it to another year if that's.
No.
Okay.
Hey, well, I'm not going to keep you. Thank you so much. Hopefully you got some information that'll be helpful for you. Don't hesitate to reach out to me if you have any further questions or anything that I can help you with. I can't really guide you. I'm not a researcher, so I can't tell you whether your project is going to tick all the boxes or anything like that, and I wouldn't be able to do that anyway, as it wouldn't be fair. But I can do some guidance if I can, as much as possible. Yeah, so if there's no more questions, I think we'll call it a day. You're welcome, Mohammed. Thank you. It's good to see you. Thanks, everyone.